Yeah, thank you so much, Bernadette. Thank you everyone who has already logged in. I would also like to thank everybody who is part of this webinar this morning. And I'd like to take this opportunity to welcome our team leader for animal health at FAO Uganda, Dr. Willington, to welcome us to this webinar before we start. Thank you. Dr. Willington, you're welcome.
Thank you very much, Sylvia. I would like to sincerely welcome all participants to this very, very important webinar. We all know that animal health workforce development is something that FAO holds dear in all its programming. Like we all know, animal health workforce, especially those that are attributed to veterinary paraprofessionals across the globe, mostly in the case of countries where livestock production is mostly still mainly dominated by smallholder farmers, like our case in Uganda. VPPs become very, very, very central because they are those that we find working at the last mile in those locations where it's sometimes difficult to find veterinarians applying to save the life of animals. So VPPs are very, very important, and we all know that in the case of Uganda, VPPs constitute a gross majority of the animal health workforce. So the development of animal health workforce is very, very important. So we have been following up this very, very important project, and I think most of you have been participants and some beneficiaries as well for quite some months now. This project actually integrates gender sensitive approaches, One Health, preventive livestock health, that targets the empowerment of the private sector, mostly those VPPs who are in the private sector. We all know that their role stands out very, very, very clear. And it's important that we must make efforts to continuously improve on their skills, because these skills directly help in the overall quality of animal health services delivered at country level, mostly among smallholder farmers. They help as well to improve livestock productivity, improving the profitability of livestock businesses, which you know it's the most important thing that people in rural areas in Uganda are depending on. So, like VPPs, the private sector VPPs have a very central position. This training also helps to support food security, and sometimes even life-saving interventions, because we have found situations in the Karamoja area where livestock is not just for profit making, but is the source of life for some pastoralists. So this project has been very, very, very important in that regard. Today we are here to look at we had to discuss, to share the information on impact, what we have achieved all this while, which I know every one of us should be proud of it. This meeting, this webinar today provides us with an opportunity to actually share the experiences and also to provide us an opportunity to thank various partners. You know, this workshop, this project has been very, very participative with a cross-section of different stakeholders involved. So it's an opportunity to also thank them and to look at the opportunities that lie ahead for continuous development of the skills of veterinary paraprofessionals. I want to thank you all for logging in and sparing time that you would have used to do some other things to focus on this webinar. Thank you so much, and I want to wish you all a very successful discussion. Thanks.
Yeah, thank you so much, Dr. Whittington, for raising this important webinar and providing those inspiring remarks. We always look to your leadership. Thank you so much. And thank you for the support that you have been to this project from the inception up to this point. We are very grateful. I'll continue to welcome the participants who have just logged in. You're almost welcome. And we have just started off. And here we have the agenda. This is the agenda that will be guiding our discussions today as we go through the webinar. So I request that we move to the next slide. Yeah, for housekeeping notes, we do appreciate that you've taken time to log in. We would like to have your information, your contact information. After this webinar, we can be able to share the recording, but also in case there are questions that will remain unanswered during the webinar, we should be able to respond to these questions. And for us to be able to do that, please register with your name in the chat, add your organization, add your role, and add your location and contact information so that we can be able to contact you in case your question remains unanswered. In addition, we have a Q&A box that is provided. Please go there as we go through the discussions. Go to the Q&A box and drop your question there. We will be responding to the questions later towards the end of the webinar. And in case your questions are not answered orally during the Q&A session, we will answer some questions in the through the Q&A using the chat, but we will also commit to contact some of the partners, some of the participants who are going to leave your information here. We will be reaching you in case your comment or question requires a response from the project team. Thank you so much. Let's move to the next slide. Yeah, thank you. We are now getting into the next part of the webinar, where we are introducing the project to you, and I would like to invite our global coordinator, Dr. Jenny Mood, to come in and introduce the project to us. Jenny, over to you. You're welcome.
Thank you very much, Sylvia, and a very warm welcome to all of those joining us this morning, and thank you for taking the time out of your day to join us. I hope you will enjoy getting to meet some of the people who have been involved in our project and have been working with many of you whose names I can see familiar in the chat today. For those of you who don't know, my name is Jenny Maud, and I am the Global Project Coordinator for the Empowering Veterinary Paraprofessional Entrepreneurs project. Next slide, please. So today we're really going to focus in on Uganda, so you'll not be hearing a lot from me. I just have a couple of slides really to set the global context behind the project. Across sub-Saharan Africa, and indeed across the world, I think we will all agree that farmers need access to good quality, holistic and preventive livestock healthcare services in order for their animals to be sustainably productive. And in many places, the provision of these services at the moment isn't sufficient to meet the need that farmers have. In particular, across sub-Saharan Africa, we have relatively few veterinarians, and still fewer of those work in more remote rural areas. And in fact, across the continent, veterinary paraprofessionals outnumber veterinarians approximately 10 to 1. Alongside this, in many countries, necessarily, government veterinary services cannot do everything, and they're increasingly focused on the core statutory roles that we require of our government veterinary services. That leaves a gap in service provision, and we think that private sector veterinary paraprofessionals are some of the key parts of the workforce that can help to fill this gap. To give a definition today, veterinary paraprofessionals typically have 1 to 3 years training to certificate or diploma level, and according to the definition that's been developed by the World Organization for Animal Health, carry out specific tasks under the direction of a veterinarian, and the exact tasks carried out vary from country to country and situation to situation. Importantly, VPPs are different to community animal health workers, who typically have just a few months of training compared to the certificate or diploma level. Next slide, please. So the Empowering Veterinary Paraprofessionals project was really formulated to see whether private sector veterinary paraprofessionals can help us to meet the needs of farmers. So the project has been funded generously by the Gates Foundation and has been implemented in 2 phases. The first one from 2020 to 2023, and the second phase from 2024 to date. The project is implemented in 3 countries, in Nigeria, South Africa, and of course in Uganda. The overall objective of the project is to increase livestock productivity at small-scale producer level. So we want to improve the productivity of smallholder farms by improving the access of those farmers to quality animal health services, and doing that through private sector veterinary paraprofessionals. So we're aiming to achieve that through 4 pillars of activities, and you're going to hear something about all of those today. So the first outcome of our project is all around locally led continuing professional development courses for private sector veterinary paraprofessionals. The second pillar looks at improving the regulation of veterinary paraprofessionals and the recognition of veterinary paraprofessionals, and really looks at ensuring that veterinary paraprofessionals are recognised and regulated alongside veterinarians and are easy to differentiate from what is commonly known as quacks, so those unqualified providers, which are often out-competing the qualified providers in the private sector. We then have a whole range of activities looking at how we can develop a supportive business environment for our private sector VPPs. And finally, and something you're joining us for today, is to do thorough impact assessment of the work that we do and communicate our findings. I'll now pass over to Sylvia, who's going to tell you all about the project in Uganda. Over to you, Sylvia. I think, apologies, we may have lost Sylvia's connection. I will continue on Sylvia's behalf and hope she'll be able to join us soon. So, Sylvia, please let me know if you join back in. On Sylvia's behalf, I will introduce the project team working in Uganda. So, as Sylvia has said, Sylvia is our national project coordinator. She works alongside Irene Mbatide, who is the Animal Health Partnerships Specialist, and Grace Nakicho, who is working on coordinating all of our training activities. And you'll meet all 3 of these colleagues today. The work of the VPP project team in Uganda is coordinated closely with Dr. Willington and the wider animal health team, as you've heard, but it's also guided by a national advisory committee, and you can see on the screen here the members of our national advisory committee, and we thank them very much for the guidance that they've provided throughout the project. Next slide, please. So outcome 1 of our project focuses on training, as I've said. The training programme was developed following a comprehensive needs assessment phase, and that included a participatory rural appraisal, which included gender considerations to ensure our outreach to women VPPs and farmers. The training program combines smartphone-based online learning that's delivered through FAO's virtual learning centres with short workshops where the knowledge that's gained during the online learning is applied in practical, skills-based, on-farm, peer-to-peer learning. The practical workshops were delivered by our partner institutes following a competitive selection process. And this was really to ensure the sustainability of the project so that these institutes can develop their capacity and continue to develop and deliver similar courses in the future. And as you can see on the screen here, our two partner institutes are the National Animal Genetic Resources Centre and Data Bank and Bukalasa Agricultural College. And we thank both of those partners for their involvement with the project. Next slide, please. So this is what the training program looks like. In the interest of time, I won't go through all the slides today, all the elements today, but the program that we affectionately call the long course is titled Growing Your Business Through Preventive Livestock Healthcare. It's a comprehensive course that consists of 90 hours of online learning and 4 short workshops, each of 3 to 4 days duration. And it's delivered over a period of around 8 months. That's to allow enough space around the workshops for our VPPs to undertake their normal business activities, their family activities, etc. The training combines preventive livestock healthcare and business skills, and each veterinary paraprofessional is matched with a local vet who acts as their mentor. Those mentors regularly meet with the VPPs and also themselves receive training from us on mentorship skills. We've engaged a total of 45 mentors in the project, and in both phases 1 and 2 we will have trained a total of 98 veterinary paraprofessionals through the programme. You can see the splits there for the different regions, and 23% of those have been female. Next slide, please. In phase 2 of the project, we wanted to also test the opportunity for shorter courses. As I've mentioned, we are very keen on sustainability, and while we believe that the long course really is an excellent opportunity to build a wide range of skills on preventive healthcare and on business, we also saw the need to test some shorter CPD courses. So in phase 2, we're piloting shorter CPD courses to look at the impact and compare that with the longer course. The shorter course focused really only on preventive livestock healthcare with an element of business skills. It included 30 hours of online learning with a 4 days workshop and didn't include the mentorship element. And we've trained 49 VPPs through that shorter version of the course. We also have a range of online only courses, so the same materials developed for the long course are used also for the online only training. And both Ugandan VPPs and vets have had opportunities to attend those courses through the FAO Virtual Learning Centres for Eastern Africa. And the one they've taken most recently has been called Skills for Sustainable Animal Health Businesses, and there will be more of those courses to follow. Next slide, please. Outcome 2 has focused on improved regulation of veterinary paraprofessionals and continuing veterinary and regulation of continuing professional development. And the objective here is to increase the number of veterinary paraprofessionals that are registered with the Ugandan Veterinary Council, and really that's partly to counteract challenges that we know VPPs face in competition from unqualified providers. So for farmers to see the value of working with a registered qualified provider. Alongside that, we have worked to encourage VPPs and vets to undertake continuing professional development and have that and support the Uganda Veterinary Council's efforts in regulation of the quality of continuing professional development. So we have developed in a participatory approach a specific competency framework adapted from the World Organization for Animal Health's competency framework specific to VPPs in Uganda. And that has been disseminated to 21 veterinary paraprofessional training institutions to guide the update of their curriculum. We have supported UVC to develop a new website, a new registration system, a database that sits behind that, and a communication strategy for the Uganda Veterinary Council. Those are being launched in the next week or two. You can see a pretty picture of the portal there, and that will really revolutionise the way that both veterinarians and VPPs are able to register and maintain their registration with the council. And shortly, the council will also be undertaking a benchmarking visit to the Kenya Veterinary Board to particularly look at the different ways that board is regulating CPD and see which lessons can be brought back to Uganda. Next slide. Under outcome 3, we have looked at developing a supportive business environment for veterinary paraprofessionals. So really, when we conducted our needs assessment, we found that there were lots of aspects that were limiting the success of VPP businesses, and our work under outcome 3 has sought to change that. We have established public-private multi-stakeholder platforms which have brought together a whole range of colleagues from the public sector, the private sector, associations, non-governmental organisations. You can see some examples here. Really to put all those people together and to have them think about what is needed and what actions they can take to support sustainable VPP businesses, and particularly to act as an incubator for public-private partnerships. Next slide, please. I think I see that Sylvia has returned. Sylvia, are you able to pick up on this slide, please? I'd just done your slides while you'd lost connectivity.
Thank you so much for the intervention. Yeah, continuing from where Jenny has stopped, going towards creating the three regional level multi-stakeholder platforms in Eastern, Central, and the Western regions. We can move to the next slide.
What, sorry?
Maybe let me also put off a video. It might improve my internet. We can move to the next one.
Okay.
Again, the project has also supported improving collaboration between veterinary paraprofessionals and veterinarians because the two cadre levels work together, and this action was led by the World Veterinary Session and African Veterinary Technicians Association. They brought together the members of the two associations, and they were able to develop action plan to work together on a number of collaborative activities, and also that culminated into organizing a joint annual conference and also preparing an MOU to ensure future collaborations between the two associations and their membership. Next slide. Yeah, thank you so much. As highlighted at the start, right from the welcoming remarks by Dr. Willington, he did talk about the gender integration within the project. Actually, gender was mainstreamed across the project activities during the identification of the needs, the training needs, the farmers' needs, and also we use the gender lens when we're identifying the gaps right from the inception of the project, and then when we were obtaining evidence that guided the design of the gender responsive VPP models, and also during monitoring at all the stages of this project. We used the gender lens and we tried to mainstream gender throughout all the project activities. Next slide. And it was important for us to measure the impact of the project so that we can be able to communicate the impact of this project with you, the key stakeholders within the livestock sector, but also key partners that we have worked with. And impact was measured at two levels. At the village level, the impact was measured using the livelihoods framework, and at the farm level, impact was measured using the mixed methods farm impact. And this was done this after 1 year post training. We have some good results that we'd like to share with you, and I would like to invite my colleague Irene to share with us the results from the impact assessment. Thank you, and over to Irene.
Thank you very much, Sylvia. Good morning, colleagues. You're most welcome. I'm Dr. Irene Batide. I'll take you through the results of the livelihoods framework first, and then the impact assessment that we conducted at farm level. I would like to switch off my video so you can be able to hear me clearly. Next slide, please. Next slide. Oh, thank you. So for the Sustainable Livelihoods Framework, this is a tool that we used, and the tool just helps us to measure how well an individual is able to sustain their livelihood. And this framework goes beyond just the financial. It also maps the person's resources, the strategies, and the contexts that affect their well-being or their finances. Next slide. So the Sustainable Livelihoods Framework typically has 5 capitals, or what we shall call the domains. But for our study, we considered 4 of these capitals. Those are the ones we measured. We were not able to look into the natural capital. Next slide. So to do this, we used surveys for our VPPs, and this was done for the cohort 1 or phase 1 VPPs, and these were a total of 50 VPPs. We used surveys, pre-training, we assessed them. Immediately after the training, we assessed them with questionnaires and evaluations. Also post the training, we sent them questionnaires, we followed up with calls, and were able to assess them. We triangulated this information using focus group discussions. Next slide. So for the social domain, this is basically a measure of how well you're connected, how you're networked, and how this affects your livelihood. So for the social domain, our data shows that 96% of our VPPs have an increased number of referrals they are receiving now post the training from their colleagues. In terms of mentorship, all the cohort 1 VPPs have been attached to mentors who are veterinarians, and these are with them in their areas of work, helping them on a daily to undertake their tasks. Majority of our VPPs that have been trained have also been registered with the Uganda Veterinary Council, which is a very important standing for someone who is going to practice veterinary practice in Uganda. Next slide. So when we assessed the physical domain, And in the physical domain, we look at things like tools, equipment that the VPPs have in their access to help them do their work. So in this, we found that 97% of our VPPs said that their record keeping had improved since the training, and the female VPPs scored a bit higher than the males in terms of record keeping. So when we assess the equipment, all the VPPs had access now to dosing equipment post the training, which is helping them improve their work and service delivery. In terms of medicines and vaccines, 98% of our VPPs said they now have access to reliable medicines and vaccines post the training through the connections that they have gotten. And this is very crucial for us as a project, especially as we are in the era of antimicrobial resistance, and we are putting forward all efforts to address this. Next slide, please. So for the human domain, this one assesses an individual's skills that they have, the skill set, the knowledge that they have to be able to deliver their work. So our VPPs self-assessed their own competences at a range of business and preventive healthcare skills. And in 7 of the 9 competences that were assessed, we had an average score of 4/5, which showed that our VPPs were now very competent to undertake their tasks post the training. Next slide. When we looked at the financial domain, this basically measures their finances, how they have improved and how they are faring. We saw these percentage increases in the number of clients per month that our VPPs are receiving, and these are disaggregated by gender, as you can see. We saw that 100% of our VPPs said that their income had increased since the training, and 86 said that this income had increased a lot. In terms of monthly income, we have here the different percentages of how the incomes of our VPPs have increased since the training. Next slide. So overall, this is the summary of how the livelihoods have improved in the different 4 domains that were measured. The green bar representing the post-training and the blue representing the pre. So you see the increase from the blue to the green. So we note that in all 4 of the livelihood framework domains, we have recorded increase, with the strongest increase in the measure of the financial capital for our VPPs. Next slide. When we did an in-depth analysis of our VPP businesses, we assessed a number of businesses, but today we will choose to highlight the business of Issa Bukoma, which we call a market-linked poultry and feeds business. Issa is a VPP who is one of our trainees that runs a hybrid poultry-focused enterprise in Luwero district. Issa serves about 90% of poultry farmers in Luwero, and he employs 7 staff. He combines technical services with market linkages. He's able to sell for farmers their eggs, their chicken, and he has gone beyond his boundaries to be able to promote the produce products to Gulu and South Sudan, which is really increasing his business and network. Issa provides vaccination advisory service and sells feeds, and his business is based on trust, in the sense that farmers are able to come and pick feeds at his store, and then later when they have eggs ready from their chicken, they will bring the eggs and pay him in turn, which he is able to market and make his money. So this is a strong example of our VPPs are running strong, successful businesses out there. Next slide. So away from the livelihoods framework, we then did an assessment of impact at farm level. And these are the results that I'm going to be sharing with you next. Next slide. So in this farm assessment, we had 4 key questions. The first one was, what are the demographics of farmers served by the trained VPPs? Has there been a perceived change in the quality of service delivery from VPPs before and after they were trained? Has there been a perceived change at farm practices relating to preventive health care before and after the training? And has there been perceived change to the farm productivity before and after the VPPs were trained? And in all this, we try to look at the gender differences involved. So we are going to be answering all these 4 questions. Next slide. So for this farm impact assessment, we used mixed methods where we had a cohort of enumerators that were trained and were sent to the field to collect data from our farmers. We also had key interviews that we used, key informant interviews that we used to triangulate this information and explore the themes in depth. Next slide. So for the methodology, we had our trained VPPs. Each of them provided a list of all the farmers they are serving. And from this list, we randomly selected farmers to interview. So this survey took place approximately 1 year post the training. And these, we are talking about the phase 1 VPPs that were trained. So we did not have a baseline for this survey. Therefore, we used the question perceived change to compare changes that the farmers saw 1 year ago to now post the training. We use this as a proxy for the before and after the VPPs received the training. Next slide. So in terms of sampling, from the lists that the VPPs provided, we had 10 to 20 farmers selected from those lists per VPP, and we covered 16 districts, 9 were in Eastern region and 7 were in Central. We therefore had a total of 175 farmers, 69% of whom were male and 31 were female. For key informant interviews, we interviewed 3 VPPs, we interviewed 2 farmers and 8 district veterinary officers from 6 districts in the country. We had 1 community leader and 1 mentor also give us an interview, and these took place in February 2025. Next slide. So for the first question of what are the demographics of farmers served by the trained VPPs? Next slide. So these demographics help us to understand the farming households which our VPPs are serving and the decision-making structures that are in these households. So the graphs here are indicating the gender, the household heads, education level, and farm ownership. And they are disaggregated by gender, the blue representing the males and the red representing the females. This is how the demographics looked like. Next slide. In terms of livestock ownership, still keep the gender colors, blue male and red for female. These plots are representing the livestock owned at these farms by gender. And we do note that many of these households are keeping mixed species. This is the range of livestock that we found at the farms, and this is how they are kept. Next slide. We also asked about the lead livestock species, and the lead livestock species at each farm was the one where the household gained more money from keeping that livestock. So here, this graph is indicating the lead livestock species in the farms, still disaggregated by gender. We find that pigs and poultry were more women-led, while cattle were more male-led. Next slide. So in terms of the tasks that are performed at the farms and who does these, this is the graph. It shows that men were more likely to be involved in buying and selling of products, produce, and also arranging veterinary care, while women were more likely to be involved in the caretaking, feeding of animals, and collecting products. This is what the graph shows, who is taking part in which activities at the farm. Next slide. So the second question was, has there been a perceived change in the quality of service delivery from VPPs before and after they were trained? Next slide. So when we looked at the different services at the farms, we tried to understand which services are our VPPs involved in a lot. And we found that VPPs are mostly involved in treating sick animals, advising on nutrition, disease prevention, parasite control, and to a less extent, they were involved in the sale of drugs. Next slide. So this slide just speaks to who is the VPP speaking to when they go to the farm. Is it the farm owner? Is it the spouse? Is it a worker? Or is it any other household individual? This is what this graph is showing. Next slide. So overall satisfaction with the VPP service, 48% of our farmers indicated that the visits by VPPs to their farms had increased in the past year. This is post the training. And 91% of the farmers indicated that they were more satisfied with the services they are providing now. Next slide. So in terms of satisfaction, these are some of the quotes from our farmers that they had to say. One said that before we used to do it anyhow, but now we do it the way she has taught us. Like treatment, we tried any medicine, but now we use her skills and expertise. This is some indicators of how satisfied the farmers were. Next slide. The third question was, has there been a perceived change to farm practices relating to preventive health care before and after the training? Next slide. So we looked at the different advice that the VPPs are providing to the farmers. And this was mainly, as the graphs here are showing us, it is vaccination, disease prevention, and parasite control. And you can see the percentages at how these VPPs are providing these services. Next slide. So we wanted to understand, has this advice the VPPs are giving, has it been able to translate into behavior change to our farmers? So we had a list of top 10 disease prevention changes after VPP's advice. These are the ones that are showed here in the graphs. We have 80 to 90% of farmers reporting that they are making improvements in their preventive practices after the VPP's advice. And we see strong gains in basic practices like vaccination and isolation of sick animals. And the farmers are frequently reporting that these changes are very helpful in improving disease prevention at their farms. Next slide. When we looked into the practice of vaccination, and this graph is focusing on poultry, vaccination in poultry. So the green color is representing the farmers that newly introduced vaccine in the previous year since the training. We do note a marked increase in the uptake of vaccination in poultry, and this is specific for Newcastle disease. It has really increased. As you can see, other vaccinations have also increased, fowlpox, infectious bronchitis. As you can see, the bar in blue represents the farmers that previously vaccinated that disease, while the one in green represents the ones that have newly started vaccinating after the VPP advice. Next slide. When we looked at vaccination practice in cattle and small ruminants, still the green bar is those that have newly introduced vaccination, and the blue is those that vaccinated prior, while gray is those that are not vaccinated. So we do see a marked increase in vaccination uptake for ruminant vaccines, and this is specific for PPR, foot and mouth disease, and lumpy skin disease. Here we must note that some of this vaccination has been due to the government effort in response to disease prevention and outbreaks. Where we see low coverage, we had the explanation that availability of vaccines was low and access to them, also lower risk in those areas and awareness. But overall, evidence suggests that the trained VPPs have driven increase in vaccination uptake by farmers. Next slide. So our last question was, has there been perceived change to the farm productivity before and after the VPPs were trained? Next slide. So in terms of change in farm productivity, we have 82% of our farmers saying that their farms are now performing better, and 70% are satisfied with this production and performance. Next slide. We did look at the perceived production improvement in terms of the lead livestock species that we asked the farm. We asked for that lead livestock species, the production metrics. If it's poultry, it was eggs. For milk, cattle, it was milk, the beef, meat, and the weight gain for also the cattle and the pork sold. And we did record increases for farmers in all key production metrics, except for goat milk. As you can see in the graph, it remained at the center at 0. We didn't have any increase, but we do note that all these other production metrics increased at the farms. Although this was based on what the farmers recorded to have been producing, the farmers remembered to have been producing before and after. It was not based on the records, but what they remembered. And these are not absolute figures, but from recall basis. Next slide. And in terms of perceived production improvement, this is what our farmers had to say. One indicated that the animals are healthier now, better feeding, vaccination and parasite control have increased growth and reduced sickness. Next slide. So overall, we find that the phase 1 project has been impactful. We see that VPP's businesses and incomes, livelihoods have improved. We see livestock farmers receiving better services, reporting higher satisfaction, and we record stronger VPP capacity, driving greater adoption and prevention practices, especially as we've seen in vaccination and preventive health care, leading to better incomes and productivity. And overall, we can confidently say that the project has demonstrated strong and scalable impact with potential to expand the model to additional regions, and countries. I thank you so much for listening to this section, and will now hand over to my colleague Grace, who will take us through the question and answer.
Thank you so much. I want to welcome all of you on this call. I'm Najjo Grace, going to take you through the question and answer. First of all, I thank all of you who have submitted your questions in the Q&A box. And the first question came from Sarapio, who is saying that he's sad that he failed his 3 attempts and is asking if he can get another chance because he's an interested candidate. I'll pose this question to Jenny to respond to Sarapio.
Thank you very much. So we have currently finished the selection for all the cohorts of trainees that will participate in phase 2 of the programme. Aside from one opportunity that is coming up, which is to take part in all the courses that are organised through the FAO Virtual Learning Centres, which are online only versions of the courses. And those are open to anybody who is a qualified veterinary paraprofessional or a veterinarian. And there is another one coming up in a few months' time on preventive livestock healthcare. Those are advertised quite widely through any networks that we can possibly get them out to. So do keep an eye out when we open the registration for that one. We will come on to this discussion later in this webinar, but while we're currently in the phase of finalising the remaining activities under this phase of the project, one of our big focus areas over the next months is to work with our training institutes to look for long-term sustainable ways that these courses can be made available to many more veterinary paraprofessionals in the future. So I hope that that's something that in coming months and years you'll be able to look out for further opportunities. Thanks, Grace.
Okay, the next question is on needs assessment for training and capacity development from Gilbert. He's asking that, did you integrate what the graduates are following as curriculum, but with few practical skills? Again, this will come back to you, Jenny.
So I'll answer this, but then I'll pass over to Sylvia as well, who I know was involved in the needs assessment. So yes, the needs assessment involved a whole range of different activities, and one of the things that we did was look at the existing curriculum at the training institutions in Uganda and indeed in the other project countries, and consider where there were gaps in that could be enhanced by continuing professional development. One of those key gaps was on business skills, because we found that many of the curriculums were designed to train VPPs for government veterinary service, so didn't include, for example, training on business skills. So that was a gap we identified. Maybe Sylvia, you could briefly give a bit more information on some of the things we did for needs assessment.
Yeah, thank you so much. The needs assessment was also finding out what type of training modalities would be appropriate for the VPPs, and these were private sector VPPs who are either working self-employed, they work on call, or they're employed by the private sector. So it was important, the type of training modality that would suit their needs. And in all the districts where we went, they preferred shorter trainings if they are physical, and they also preferred online trainings, and that's how we ended up with the blended model. And also because we're dealing with the private sector, they needed business skills so that they know how they handle the clients and the finances that they receive. So that informed the design of the training that we delivered. Of course, this was a CPD training, knowing that these are people who already have the primary training, so it was made to bridge certain gaps, but also to refresh their knowledge in preventive livestock health care. I hope this is sufficient.
Thank you, Dr. Sophia. I think this one goes to Dr. Irene. There is a question here from Ogwang, When was the assessments carried out and in which regions were covered? Over to you, Irene.
Thank you, Ogwang, for that question. The assessments were in February 2025, and we covered districts in central and eastern Uganda. We covered a total of 8 districts. Thank you.
Yes, this one is coming from Nikunze. What other qualifications do you consider in selecting the VPPs to be trained? Jenny, can you come in on that?
I think I'm definitely not the best person to answer that question, but there is an important point that I'll emphasize and then I'll hand it back to you, Grace. So an important point to emphasize here was that a key part of the project is the improving the way that VPPs are regulated through the Uganda Veterinary Council. And we see that as so important for VPPs themselves and their businesses, and the ability for VPPs to say, you know, I am a professional, I'm professionally regulated, you can trust in my services. And if somebody comes to your farm who is not regulated in this way, it's likely that they are not as high quality a provider. So that's the emphasis on registration with UVC. But then I think, Grace, you're much better qualified than me to explain what that means in practice.
Okay, I think Jenny, I can come in. Maybe I can support in adding a response to that. Since we were training, VPPs were supposed to be registered by the Uganda Veterinary Council or the Veterinary Statutory Body in Uganda. One of the key qualifications was that the VPP was trained by an institution that is recognized by the regulator, the Veterinary Statutory Body. I know there were many applicants who applied, but they had qualified from institutions that were not yet on the list of the Uganda Veterinary Board then, which has transitioned to the Uganda Veterinary Council. So in that case, unfortunately, we will not be able to select those ones who are not from the institutions recognized by UVB, since CPD is important, and also being registered was important by the regulator. Thank you.
Yeah, thank you, Dr. Sylvia. In summary, you need to have studied animal health related course from a UVC recognized training institute and registered with Uganda Veterinary Board, in summary. Okay, thank you so much. Mukoni, I was trying to see where this question originated from, but there is somewhere Gilbert Mukoni is saying, yes, for quantitative, I was referring to the mortality rates, disease prevalence, variation frequency, consulting VPPs due to preventive measures, quantity, vet medicine. Jenny, did you check in the chat and see? Because yeah.
I can try to answer.
I think it follows the curriculum, practical skills curriculum.
Yeah, so I think one thing to mention is the farm level impact surveys that we conducted were really quite detailed, and we don't want to bore all of you this morning with every small piece of data that we collected. So there is some more data behind that we presented today. Gilbert's asking specifically on which sort of indices we use to look at productivity on the farms, etc. This was quite a challenge because I think many of you will realise that measuring impact at farm level from this kind of intervention is quite difficult because there are many different factors that influence productivity at farm level. And also many of the farms that we work with do not keep very full records of their productivity levels. So we don't have a kind of month by month record of milk production or egg production, for example, on many of the farms that we worked with. So in terms of the productivity indicators that we've used, the first thing to note is that we are relying on recall because we didn't have a pre-survey. We're asking farmers to recall how their farm was 1 year ago and then how it's changed now after they've received services from one of the VPPs we've trained. and you saw very high levels for perceived improvement in productivity by those farmers. So they said they thought their productivity had improved. And then for their lead livestock species, so the main species on that farm, we asked them to give us numbers that they could either recall or they did have recorded for indices such as milk production. And we did see increases in those indices. But firstly, that by the time we broke down into all the different lead production species, each particular production metric, we didn't have that big a sample size, and often it was based on recall. So I don't think we can, through this impact assessment, say, you know, milk production increased by an average of 3 litres. We can say, however, that the farmers perceived that their farms had become more productive, and we took some measures to try to approximate that. Back to you, Grace. I think we may be reaching the end of our time, unfortunately, but I see a lot more questions that we can answer by typing during the rest of the session.
Yeah, thank you, Jenny. There is a lot. Kindly, panelists, respond in the chat box or in the Q&A box, because there is one from Obao, and there is another one from Balije Nicholas. Kindly type the response in the box as we proceed. And allow me at this time welcome our partners to give us their testimony about the impact of our project to them. So I'll start with Chairperson now, Mr. Geoffrey. Please, you're welcome.
Thank you, Grace. Maybe briefly also I'll have my video put down so that I can have good connectivity. Hello everyone, thanks for joining. My name is Geoffrey, the President Uganda Veterinary Paraprofessionals Association and the Chair National Advisory Committee of the project. This project has had really good impact with the veterinary fraternity and the farmers at large. And these are some of the ways that we have had the impact of the project. We have had an enhanced professional recognition of our VPPs. Our VPPs have attained CPD trainings, and these CPDs have helped them register with the regulatory body, making them professionally recognized. We have also had their strength and technical capacity of our VPPs through the trainers, from mentors and trainers from these training institutions that are very competent and have imparted most knowledge and skills on top of what they are trained from their training institutions, knowing that we have over 21 VPP training institutions. So we've also had an improved community engagement through a component of the outreach of the project. The VPPs that have been trained have had farmers that have visited through the outreach program, and in one way or the other, this has increased their community engagement and also creating awareness through the project and the existence. That explains how we are telling you that their participation in the projects and the visits that have increased, the farmers contacting them for their services has also increased because of this community engagement through outreaches. We have had business growth of both the VPPs that are engaged in this project and also our farmers. And this has helped their livelihood increase, more stocks, and improving their household income in terms of sales, profits made, and adopting the preventive healthcare approach on their farms. We have had an increased farmer satisfaction through the services of the VPPs who have been trained under this project. It's good that we are going to have an interaction with farmers being represented on this. It will be good that it's got from the horse's mouth how this project has really benefited the farmers that have interacted with our VPPs under this project. And nonetheless, as the President UVPPA and the Chairperson of the National Advisory Committee, it is also my humble appeal that we look forward to more phases of this project, and also try to extend this project in regions that are not yet part of it, the northern region, the West Nile sub-region, so that we have VPPs that can also participate in this. The project team, FAO and the funders are aware that the number we have trained so far is just a drop in the ocean. We have over 30,000 VPPs that are trained who also want to benefit from these services. And nonetheless, I am happy and thankful for the impact this project has really had. I beg to submit.
Thank you so much, President. Next, we are going to hear from UVC, Uganda Veterinary Council. Dr. Cassidy Florence is not with us, but she shared with us a recording. Please, Benedetta, can we have her recording?
The Uganda Veterinary Council has benefited a lot from this project. First and foremost, we were able to develop day one competencies for veterinary paraprofessionals that is to guide veterinary paraprofessional training institutions, and it will harmonize training throughout the country. Secondly, we were able to develop online registration and licensing and a database of all veterinary professionals, including veterinary surgeons. And that is going to go a very long way in easing annual licensing and retention for both public and private sector-based professionals. Thirdly, we will be making a benchmarking visit to Kenya, the Kenya Veterinary Board, a regulatory body that has been in place for years, and Uganda will have a lot to learn. And in that, we'll also be able to create relationship within the region, and then going forward, we'll be able to benchmark each other, learn from each other, and build each other as we develop the veterinary profession. Last but not least, Uganda Veterinary Council is indebted and very grateful for Food and Agriculture Organization for having supported us in all these three endeavors. We are truly grateful and will be remembering this project. We're looking forward to an upcoming project in which UVC could be supported to widen and sensitize all veterinary professionals in Uganda to use the database for annual licensing. Thank you very much.
Yes, that was UVC. Let me welcome our collaborating training institutes, Bukalas Agricultural College and Greek DB. Let us have Bukalas first. Over to you, Principal. Next slide, Benedetta.
Maybe you can start with Greek.
Yes,
Greek and we
Mr. Chisolo.
I'm around. I can start.
Okay.
Yes, please go ahead.
Okay, thank you so much. This is Gelvan Chisolorule, the principal of Bukalas Agricultural College. This is a public tertiary institution. I think everyone is aware of it, because we are Ugandan chapter. We graduate about 400 VPPs annually, who join mainly the private sector. Government employment has become very scarce, especially in the last 20 years. And therefore, this project was quite timely especially to our private practitioners. We are very grateful to be part of this project because it is been able to enhance several things for us as the college. First of all, we have been able, through a series of activities, which also included direct training, we have been able to build our capacity in blended learning methodologies, a skill which goes beyond VPP training and also used directly in other programs. Staff capacity has also been strengthened in the development and the implementation of continuous professional development curricula. The second is that we have now attained accreditation, and the enhanced staff capacity mentioned has enabled us successfully to apply and obtain accreditation from the Uganda Veterinary Council as a CPD provider for VPPs in Uganda. This is a milestone that has strengthened institutional credibility, both nationally and internationally. We have also, under this very project, we have been able to get support from the project for providing CPDE, and this has enabled us to upgrade our hostel infrastructure to improve students' accommodation. At least some of the accommodation areas have been improved. And while trying to ensure effective blended learning, the project has also helped us improve our training facilities in areas of ICT. We have acquired some ICT equipment and also improved on our website and also the connection areas to the network. Going forward, we have had chances to interact with a number of stakeholders, and therefore one of the other enhancements we have received is to open up new doors for both local and international partnerships, which we expect to last a longer time. And we also expect to use the same partnerships to expand our areas of collaboration in very many areas, which will also help maybe in the sustainability of this training, but also to introducing new collaborations. We have had collaborations with mentors, with the individuals, alumni associations, and we have also enhanced our community relationship. I think it has quite improved because of this CPD. On the other end, we have also had opportunity to provide CPTs. We have been able to strengthen our element of stressor studies. We have been able to work and track where a number of our graduates are and what they are doing. As a result, our alumni association has been rejuvenated and established new leadership with focus of working closely with the college management. And I think this has been very well because of this project. We are very grateful for giving us this opportunity, and we thank you very much for what we have been able to achieve. Thank you very much.
Thank you so much, Principal. Over to you, Dr. Benda for Agrican TV.
Thank you, Grace. Good morning, everybody. My name is Katali Benda. I work with the National Animal Genetic Resources Center and Data Bank as manager satellite stations and Breeders Association. So we are grateful to the Food and Agriculture Organization of the United Nations for having considered NAGRIC to be partners in this project. NAGRIC became a partner in 2022 during the pilot phase when we competed and got selected to undertake these CPD trainings. So these trainings have been transformative in terms of capacity building. We have increasingly seen, as you might have seen in the impact report, that our VPPs have gone beyond being syringe jabbers to now focusing on preventive livestock healthcare and focusing on productivity improvement on the side of the farmers. And we have achieved this through innovative and inclusive approaches. And as an institution, we have really benefited in terms of capacity building of our staff to use these innovative approaches, such as the blended approach of delivering these programs. But also as an institution, through this program, we have acquired accreditation and also legitimacy, both in Uganda, but also across the borders. Remember, this project is being conducted in more than 3 countries, and through the interaction with our colleagues in other countries, the institution has acquired that legitimacy. So overall, we have realized institutional capacity development to deliver quality, accredited, and gender inclusive animal health services. And this has positioned NAGRIC as a national leader in delivering continuous professional development courses to actors along the livestock sector, both veterinary professionals, but most importantly, the veterinary paraprofessionals, as were the targets for this project. So we are grateful to FAO and the Bill and Melinda Gates Foundation for having funded this project that has actually opened our eyes to things that we never thought about before. For instance, right now, as you all are aware, NAGRIC has been conducting artificial insemination trainings over the last 20 years. But through this project and from benchmarking with VLC and all that, we are now shifting towards having blended approaches. We are now shifting towards apprenticeship approaches so that the trainees and also the people that they serve benefit immensely. So we are grateful to the project team, Dr. Sylvia, the national coordinator, Grace, Irene, to Jenny, and all the other staff that we've been working closely with for this opportunity that has immensely benefited NAGRIC and Uganda at large. Thank you very much.
Thank you so much, Dr. Benda. Now we are going to listen to our beneficiaries, the trainees. We are going to listen to Salima in very few minutes. Please, Salima, try to summarize because time is not on our side. Over to you, Salima Abdallah.
Okay, thank you, Grace.
Benedetta, next slide.
Thank you, everyone, colleagues. The impact of empowering me as a VPP entrepreneur in growing my business. Before the VPP training, my focus was primarily on treating sick animals, that is reactive care. Also, before the training, I had limited exposure to preventive livestock health practice. But after the training, I gained skills in preventive livestock health care through vaccination planning and scheduling, biosecurity measures, herd health planning and management, farmer advisory services, and record keeping and documentation. Also, after the training, I got a clear shift from reactive treatment to proactive preventive treatment. On the business aspect and management, at least I'm now better off in pricing services effectively and efficiently. Also, inventory management, maintaining clientele records, all those attained as a result of the VPP training within this short period of time. Also, there is transition from emergency-based care to a planned one. I'm also able to structure my services and communicate value effectively to farmers. So in all, the training has transformed my approach from reactive to proactive livestock health care while building sustainable business skills. So I'd like to take this opportunity to sincerely thank our dedicated partners and tutors from FAO for all the support and guidance. Thank you.
Thank you so much, Abdallah, for that testimony. Next, we have one from Karamoja, Nakapiripiriti. One of the questions was, has the project gone to Karamoja? Over to you, Milia, from Karamoja, Nakapiripiriti.
I greet everyone. I am Miriam Ofkwa, a veteran paraprofessional and a member of National Advisory Committee for the VP project under FAO in Uganda. I am a female. I own livestock treatment center called the Click, located in Nakapiripiriti district in the northeast of Uganda, a place with a large number of cattle and sheep, mostly. They also rear pigs, poultry, donkeys, and a few rabbits. I deliver quality services to pastoralists both within and outside my home district. And I trained at Nagrik DB and at Kasolia Stock Farm. And I was the first in the first cohort. Technical skills and handling. Before the VPP training, I was relying on observation and history method, then go ahead and treat the animal. But after the VPP training, I now examine the animal more thoroughly, checking system by system with the use of digital thermometer and stethoscope received from FAO after the training. With this examination, I arrive at the correct diagnosis, administer the treatment, and advise the farmer accordingly. On animal handling, before the VPP FAO training, I would mobilize pastoralists to hold the animal for treatment and parasite control. This was very hectic and tedious. In the process, the animal struggles, resists, and kicks about, sometimes hurting the pastoralist and even myself. Now I'm using the restraint method I learned from the training. That is the cattle crush, which I came and constructed one with the local materials. And now handling animals has made my work easy, fast, and safe. Clinical competence. Before the VPP training, I was not very competent. I was not using stethoscope and a thermometer. I would not take time checking animals system by system. But after the VPP training, I'm able to diagnose, treat, and advise pastoralists accordingly. The animals recover even in cases of snake bites. And I purchase my drugs from recognized importers as advised at the end of the training. Business and record skills. Before the VP training, at my center, I was only using cash receipts books only. But after the training, I learned all the necessary records required in the business, which include the sales, the purchases, the stock, the data, the assets records. With all these records, I'm able to track the progress of the business and diseases and parasites in the area, which I report to the district veterinary office. While the daily sales track number of pastoralists who visited the center that day, in a month, in a year. In the daily treatment records, we record the sex, the age, the color, the telephone number, the sub-county, the parish, the village, and the disease and the drug administered, and then the telephone number of the farmer for follow-up. farmer training improved by security measures. Before the VP training, I was not able to advise pastoralists on biosecurity measures. I had little knowledge about biosecurity. But after the VPP training, I have constructed a raised goat house that allows urine and droppings through, and then it's cleaned regularly. And with this leaves my goats clean, free from infection and predators. And the pastoralists have picked up the idea. They respond to mass vaccination, they practice hygiene of the premises, parasite control, which is reducing infection in their livestock. Hence, the productivity in my area has increased. I'm adding this one, gender and sensitivity. Before the VPP training in my center, it was mostly men visiting the center. After the training on the gender, I could talk to women in the communities to take responsibility in animal health. I trained them on simple diagnosis like simple diagnosis like if their animal is dilating, those signs of maybe coughing, limping, she should take the animal for treatment. Now the women are picked up and they drive small ruminants for treatment. I submit others. I thank so much.
Thank you.
Thank you. You're welcome.
Thank you so much, Lydia. Let us hear from one of the farmers, the VPP, the trained VPPs has been serving. Over to you, Mr. Isudo Julius from the East.
Yes, good morning, everyone. I'm Mr. Isudo Julius, a dairy farmer from Kumi, Mkongoro sub-county in Okudumo parish and Kurachi village. So before the BVP, I had no option. But after attending now okay. So I've been back. According to the advice I got from my technical advisor, that's Mr. Okay. I've now gained over 50 liters.
I think we are not getting him so well because of internet.
I'm now enjoying benefits. I'm now somebody who was so you lost me. In the case of internet in the village, as we're deep in the village, you did not even reach you cannot even reach me. So I've now got a chance to say something about my farm. So even the diseases which we are attacking, I was saying even the diseases which we are attacking my farm, they have reduced. Foot and mouth diseases, the tick control, I've got the advice, the technical advice. I'm now free from that. So even my
we are losing him because of network, I think. Thank you so much, Mr. Julius Isudo. I want to hand over to Dr. Sophia to welcome the representative CVO. Over to you, Dr. Sophia.
Yeah, thank you so much, Dr. Grace, and thank you everyone who has been part of this very informative webinar. And of course, FAO Uganda works with and on behalf of the Ministry of Agriculture, Animal Industry and Fisheries. Before we implement any project at FAO, we must get concurrence from the ministry, and everything we do, we keep consulting with the ministry. So this project, the National Advisory Committee of the project, and a representative of the CBO and the Ministry of Agriculture, Animal Industry and Fisheries, and Dr. Mary Flavia Nakanyako has been serving as a focal point on the National Advisory Committee. And also, it so happened that this morning, our CBO is very busy in a meeting where the minister is participating. The minister has invited them. She's not here, and she has delegated Dr. Mary Flavia Nakanyako, who is already very familiar with the project. I'm very pleased to have you, Dr. Nakanyako, as the representative of the CVO, who is going to give closing remarks on in this webinar. I invite you, Dr. Mary Flavia Nakanyako, please come and address us and give remarks, closing remarks on behalf of the CVO and on behalf of the ministry. I thank you so much for the support you have given us throughout project implementation. Thank you. You're welcome, Dr. Flavia.
You can see me. Yes, me.
Yes, we can see you. We can hear you. You can go ahead.
Thank you so much, Dr. Sylvia. Thank you so much to the team that you work with at FAO. Thanks to all the participants and trainees. Thank you, everyone who has made time to attend this meeting. I'd like to convey apologies once again from the CVO. She hasn't been able to make it because of other pressing meetings and issues she had to attend to at the ministry. But she's aware that we are here and she delegated that I give some remarks. We have been happy. So first and foremost, I would like to appreciate FAO. I'd like to appreciate FAO for implementing the VPP project and for being our long-term partner in capacity development of our officers, both government and private sector. Yeah, because as you're all aware, we also had this event that was doing capacity building for in-service professionals. Now we have this VPP project that is also building capacity for the private veterinarians. So we are very thankful. FAO is our very dependable partner on so many occasions, not only capacity building, but also surveillance of diseases, outbreak response, policy development, and many others. Mentioned but a few. So we are really grateful for the partnership, and I pray that it will only grow stronger. I would like to, as you're all aware, after government restructuring in the 1990s and privatization of veterinary services, there was downsizing of the human resource in government. So which means the farmers had to demand for the services at a fee, veterinary services at a fee. So at a fee, and even there was no program, designated program on how these private veterinarians were going to be trained and given capacity, given the tools which they would use to offer excellent service like it used to be in the government setup. So FAO coming up with such a program is very instrumental in making sure that even farmers who are demanding for services, the veterinary services that were privatized, they get value for money and they're able to grow their herds, like some testimonies I've already had, and they're really able to grow. So I would like to thank FAO because in this VPP project, as you've already heard, there have been capacity has been built for the private vets in disease surveillance, detection, reporting, diagnosis, and good practices in livestock farming, advising the farmers on the key biosecurity measures, going preventive other than curative, doing herd medicine other than treating individual animals, whereby we can even fight upcoming issues like antimicrobial resistance. So really, we would like to really appreciate FAO for this initiative, and Bill Gates and Melinda, who has been funding this project. It's really, like I already alluded to, it aligns very well with the government priorities of improving service delivery. As I already told you that the services were privatized, and there hasn't been a sound program for training them. So we are grateful that this program has come up, And as I've already seen, I pray that even more districts will be brought on board in the next phase, such that many more private veterinarians can benefit. And even as we go along, include also the few government paravets that are there. So we thank FAO and look forward to continued collaboration for better livestock sector. Thank you so much for good and my country. Thank you so much.
Thank you so much, Dr. Flaviana Kanjako, representing CBO and our mother ministry of Agriculture, Industry and Fisheries. We do appreciate you for the support and guidance that we have always received from the ministry, and we pledge that even at the end of this phase, we will be visiting the CBO's office. We would like to pay courtesy call and also share some of the hard copies of the reports and publications that have come through this one. Please convey our regards to the CBO and best wishes. Let me hand over to Jenny. Thank you.
Thank you very much to Sylvia, and thank you especially to all of our speakers today. We've been on a very nice tour around Uganda. I'm very sorry we couldn't hear Mr. Julius quite as well as we'd have liked, because the most important person in this meeting is in fact the farmers themselves. So, but I thank everyone for speaking and giving testimony to the value of the work that's been done so far. It just leaves me to make a few comments to round off today's session. Next slide, please. So first of all, we would like to give you a few notes on how you can find out more about the work that we've been doing. So first of all, I've shared in the chat box some links to some websites and some of the publications that we've made through the project, and I hope you found those helpful. A reason why you were all asked to take the extra step of coming through a registration link for this webinar is that you will be sent a link to the recording and also a link to some further materials after this webinar. So all of you who registered for the webinar will receive a link to the recording and other materials. We would love you to get in touch with us, and I'll ask one of my colleagues if they could just type these email addresses in the chat while I'm speaking, but please do get in touch with us, myself, Sylvia, Grace and Irene, or the email address we have that gets hold of all of us, which is vpp@fao.org. So if you'd like to know more about our activities or you have ideas on collaborations or future work that could be done, please get in touch. To also let you know that coming soon, there are going to be various different publications coming out of this project. We'll be publishing in a lot more detail the impact assessment results that we've shared with you today. And there are 3 webinars at global level coming up, sharing different aspects of our work. So one with the World Veterinary Association and the African Veterinary Technicians Association, looking at the work we've done with the associations in each country. One looking at the work we've done on the business environment for veterinary paraprofessionals, and one looking in more detail at our gender responsive livestock healthcare approaches. So keep an eye out for those webinars which are coming up over the next few months. Next slide, please. So I have 2 more slides before we round up for today. One is a huge thank you. I think you will have gathered here that there are many, many people involved in this project, and we would like to thank everybody both within the FAO team who's supported this work, and also our partners and collaborators, many of whom you can see listed here, and unfortunately I don't have time to go through all of them. I will say, however, that by far the most important people to thank are firstly the veterinary paraprofessionals who we have worked with and who have worked so hard on the training, their mentors who are conducting their work purely voluntarily and making a huge difference to the VPPs that they work with, and some of whom are with us today. And of course the farmers who all of those are working with and who have taken part in many of our impact assessments. Finally, of course, all this work was funded by the Gates Foundation, and we thank them very much for their contribution. Next slide. So when I just come to really have just a few closing remarks from myself. And I'm here today, and I should bring apologies from Zelalem Tadesse, who is a Senior Animal Health Officer in FAO and is the lead technical officer of the project. Unfortunately, we've had a few last minute problems today, and he also is not well this week, so he couldn't join us. So I'm speaking on his behalf. We within the project believe that private sector veterinary paraprofessionals really have the potential to sustainably transform the way that livestock services are delivered in Uganda to support improved livestock service delivery. But this is especially when, and this is, I suppose, here the learnings we have from our project so far, the services they provide are focused on preventive healthcare. They're not just jabbing, as Dr. Bender said. When they are collaborating effectively with veterinarians, collaborating well with the government veterinary services and with other private practitioners, when they're well regulated, when qualified VPPs are recognised and able to be distinguished from quacks, and when they're able to access what they need to have an effective business. So they can access quality pharmaceuticals, they can get their services to farmers, they can access finance, and most importantly, and something we'd like to really promote, is the opportunity for public-private partnerships to enable that private sector service delivery to be sustainable long-term. And if we can have the private sector service providers in Uganda really thriving with good businesses that are sustainable for them and that are providing good quality preventive healthcare services for farmers, then the studies that we've shared with you today show that improved service delivery leads to improved livestock farmer livelihoods, and we can consider that also leads to reduced One Health disease risks, so reduced disease risks both for our livestock but also for ourselves, and reduces the potential for antimicrobial resistance, which, as we all know, is one of the great challenges that we face now and in the future. As we are doing just a few more project activities from our current phase over the next months, we're also really looking to the future. And as you've heard, we'd now like to transition to a phase where we are able to continue to deliver all the great things that have been done, to continue to use all that has been developed, both in terms of training materials, in terms of the multi-stakeholder platforms, in terms of all the partnerships that we've developed. So we want these to be sustained, to continue and to grow. And we are looking essentially for partnerships, for ideas, for colleagues that can help us to direct this in a way that can be done in a sustainable way. So if you're interested to know more about the project, if you're interested to see this project continue, please contact us, please advocate for the value that it brings and help us to look for solutions that can continue this work into the future. And I will finish there and hand back to Sylvia to say goodbye to all of you.
Thank you so much. I know some people have already dropped off. I wish, I'm just here to say thank you. I wish I can be able to say it in every language represented in this this meeting, but allow me to say thank you. And if possible, I'll request Benedetta to stop sharing and just turn on our videos and wave goodbye before we exit. Thank you everyone. Thank you Ugandan team, thank you global team, Jenny and everyone. Benedetta, Emmanuel, and everyone who has given so much support. We are eternally grateful to each one of you. And Emma, Alegi, thank you so much. If you don't mind, Emma, I hope it is okay to take a digital photo. I hope we have a consent of everyone just to take a photo. Although many people dropped off, we could have one record just for this phenomenal webinar that we have just had. Thank you so much, our dear partners. Principal is here. He did not delegate. He managed to create time to be here. Personally, representing Kwasa Cultural College. Thank you so much. Convey our gratitude to everybody. from Ukalasa family. Thank you, Dr. Willington, for the leadership and the guidance you've given to us. And thank you everybody. Thank you, Jenny. Thank you, Salima and Miria, for representing many other trainees. Thank you, Mr. Julius Isudo, Arama Noi. We send you our best wishes with your farming enterprise. And I hope one day I'll get to visit when I'm not sent by FAO. I would love to visit you and see how you are doing in the coming years. Thank you so much. Let us keep the conversation via the emails that have been shared. And in case any question has not been answered, we promise that we'll be able to respond. And everybody else whose face I'm not able to see, Dr. Flavia Nakanyago from the ministry, representing CBO. Thank you so much for gracing this webinar and making the remarks on behalf of the CBO. Please convey our gratitude to everybody in the ministry. We thank you and wish you the very best of this day and the very best of this season. We promise to keep in touch. Thank you so much. Wishing you a very good day. Thank you and bye-bye. Over to you.
Thank you. Bye-bye.
Thank you. Bye.